So I was a ski patroller for many years. One of the guys I worked with went off to med school. And during that process, I was like, oh man, I'd love to go back to school and become a doctor. And I said, but I'm too old, take too much time. And he said, have you thought about becoming a PA? And I wasn't even that familiar with what it was. So looking into it, I suddenly realized that's something I can accomplish in a shorter amount of time. And so I decided to go for it. And I have changed careers sort of in this pattern, so this isn't number 2 for me. It's been a few other ones. It was scary to start at EVMS for sure. I felt like I was older. I had been coming back to school for my prerequisites, but this seemed like a higher level. But my classmates were great. The computer was odd to me, and they would laugh, but they would laugh with me, and they taught me all the short tricks and how to get through it and how to deal with it. And then at times when they seemed frustrated about life, maybe I was able to help them in return, but that was really awesome. And having an apartment and walking back and forth to school, like living in the city again, that was awesome. It's crazy hard. There's pictures, there's classic cartoon of like the student with his mouth open and a fire hose. I think that's what the first year, 14 months didactic is like. So you gotta be prepared for that. Your family has to know that you're gonna be prioritizing school. I think you should be confident that when you're done, you're going to have a great career ahead of you. And I love seeing the patients. The emergency department right now is really tricky for me because they kind of come and go. And that's the other great thing about being the PA program. I don't have to pick a specialty. I could go into dermatology tomorrow, do that for 5 years and head off to cardiology and then end up in family practice or any of those. So that ability to pick and change your mind and re-pick is awesome. I think that's the huge advantage of the PA program.